welcome to the Holistic Living, Learning, and Loving podcast, where we are bringing you back to the basics.
We explore sustainable living and holistic health and strive for progress, not perfection.
So please join us on a wellness journey and feel empowered to make positive changes in your life. Hey guys, welcome back. We took a little break last week, and we honestly didn't even tell anyone. We didn't even post about it online. We just okay, well, we're just not doing it. So we took a break, a little mental health reset, and are coming back to you this week. We are going to talk about alternative medicine, and I kind of started this alternative medicine program. I don't know if that's what you would call it. I think back in about 2021, I kind of started seeing a functional doctor instead of a normal doctor, and then kind of have grown and done lots of random different things. And I think it probably started with IVF, because whenever you're going through IVF, you're just like desperate to have a baby, and like you'll pretty much try anything.
Yeah.
So I tried acupuncture and all kind of crazy stuff. I mean, not that that's crazy, but
Just different.
yeah, just different. So we'll kind of talk about different types of alternative medicine, what we've experienced, and what we learned whenever we were writing this, preparing our stuff for this episode. So I know you follow some functional doctors.
Yeah,
right.
That's kind of like how I got started in this whole journey. Was I started following Dr. Josh Axe and Jordan Rubin, which I've kind of veered away from them and more towards there's so many people I follow now and listen to, but I've learned that there's just so much, I think functional medicine has kind of people are like, oh, like that's the answer to everything, and although it is a great answer and a great alternative to the conventional medical system, it's not the only thing. And I think like what we're going to cover, there are so many different approaches we can take, and I think the moral of the whole story is that we really need to listen to our bodies and be in tune with our bodies and try to regain that instinct of knowing how to listen to our bodies and knowing what we need, and then seeking the right avenues. First of all, we need to be the biggest advocates of our health. Like, trust yourself and your own knowledge, or seek out the knowledge and trust that you can do this yourself, and then seek out the appropriate therapy that you might need. And you might not figure it all out. You might not figure it out all at once. But, it's a process, it's a journey. But we live in an amazing time right now, like in history, to live the longest, but not, we already are living longer than ever, right? But we're not living the best quality of life out of all of time. We're living longer, but we're living lower quality lives by, significantly. So if we would use this, this new knowledge that we're all gathering effectively, we could live longer and great quality lives if we balance out the conventional medical system for acute care and like trauma with broken bones, immediate acute care, because we have antibiotics for and surgeries for life-threatening situations that can save us. So that's the great thing about the Western conventional medical system. But then we also need to embrace the alternative medicine and natural-based therapies to for preventative health and longevity.
Yeah, I think I've been seeing a couple things pop up on Instagram, whatever. So I saw something that said, the average person retires at age 65 and then lives approximately to age 75 or so, let's say. I think it was maybe 12 years later. So they have 10 to 12 years of being retired. But typically those years they're spent battling hypertension, cancers, all these different immune system disorders and all this stuff. So it's you're working your whole life, padding your 401k, worrying about retirement. But in retirement, you might have the money, but do you have the health to live the kind of life that you want to live? So it's it really makes you think. And then what Mike said recently about something else, but it applies here, is that I think that we are getting accustomed to living a lower quality standard of life.
A hundred
We're getting
percent.
used to it. We're getting used
Yes.
to eating bad food and having side effects and not feeling good, getting immune disorders, all this stuff. We're just used to it. And no
Yeah,
one's
that's
really like ringing the, well, some people are ringing the alarm bells, but a lot of people are just like, I don't get it, but let me continue.
yeah. Like that's I heard somebody say this the other day. They were like, we all have feel like crap syndrome. Like we are just used to feeling like crap that we think that it's normal. We think that this is a normal process of aging. I
Mm-hmm.
mean, we're all in our 30s saying, "Oh, sucks getting old." Like, no, that's not normal. Not even in your 40s or 50s. We're not supposed to just feel like crap already. Honestly, I don't believe that we're ever supposed to just really feel like complete crap all the time. And it's all about just the way we're living in our environment. And once you start living a better, like you start eating cleaner and you pay attention to your environment and the things you're putting in on your body around you, and then when you go back around those things, like me and Nick were talking about this a lot lately. What did oh We went to the beach the other day. I didn't have anything cooked and the kids were hungry. They were begging for pizza. I got them pizza. Oh my god, both of them didn't even want to finish it. They felt so bad after. Okay, we
Uh-huh.
ate pizza on the regular just a few years ago, and it wasn't that big of a deal. But we were so used to feeling like crap. Nobody knew that was the cause, right?
Mm-hmm.
Even the kids. But now it gave one of them's diarrhea so bad, and the other one was like, "Oh, my stomach hurts and her bones are hurting." Like things we would have never noticed or realized before. And it's
Jeez.
just when you're constantly eating that stuff or around a bad environment all the time, you're just so used to feeling like crap that it's
It's
normal.
true. It's absolutely true.
Yeah.
So anyway, back to functional doctors.
Oh yeah.
So like you go to the functional doctor when you feel like crap, or for me it was my hormones, like what's going on, I'm not having periods anymore, and I want to get to the bottom of it because if I go to the doctor right now, okay, this was a couple years ago, but even now at 39 years old, I go to the doctor and they're like, oh yeah, you're just going through menopause, and it's like, isn't that a little early? And they're like, it's different for everybody, like moving on. They're like,
Yeah.
okay, well, we could put you on hormone replacement therapy. We'll get you pumped up with estrogen. We'll get you some progesterone. We'll get you some testosterone, like all these things. And I'm like, dude, like, I don't know about that. So then that kind of led me to the functional doctor. And kind of what they do is they have a different approach, okay? Like a regular doctor will test you for, like, if you say, oh, like, I feel, like fatigued all the time, then they'll be like, okay, well, you're a woman. We'll test your iron to make sure your iron's fine or whatever, We'll test your thyroid, maybe, they'll do like 2 or 3 tests and they like call it a day. If they don't find it, they're like, well, not sure. And then they, kind of sometimes with conventional medicine, especially with women, they kind of make you feel like invalidated or crazy about how you feel, like, because they're like,
Oh
well, I don't know
yeah.
what's wrong with you, maybe it's in your head, it's like,
Oh, Nick
well,
has experienced that a lot.
yeah, and that's not fair. So
Yeah.
functional doctors take a deep dive. They will order a ton of blood work. They'll test all these different like minerals, heavy metals. They'll do like a full like blood panel workup, test like different elements of your thyroid, not just like your normal like whatever T4 or something. They'll test like the TSH, the T3, all these different things to really give you a full picture of how the thyroid is working. But they'll do a ton of that. I know for my, so that first one I went to, they did all that, and then they were like, okay, well, you're deficient in magnesium, which pretty much everyone is, and a couple other things or whatever. And then I've kind of gone through different functional doctors in the past too. I switched it up, and this last one, they did a GI map because they were like, oh, your hormones are directly impacted by your GI system, and we need to get to the bottom of that, because if you have like leaky gut, if you have parasites or overgrowth of different things, then you're not going to feel better until we resolve that stuff, because like the gut is everything.
Right.
So we did a GI test where I had to poop in a little, like, you know, those little like carnival like food like cardboard containers. It was
Yeah.
interesting. So yeah, I had to poop in that, and then like dig in the poop for
Oh
like and
God.
collect the sample into a little jar. So like this is not for the faint of heart. It wasn't fun. Um, so I did that and shipped it off to this lab. Poor people that have to deal with poop all day. And then that came back and it was like, you know, I was low in certain things like acromantia, I was low in, and I had a lot of like strep bacteria or whatever and different things. So, and leaky gut. So she kind of put me on a bunch of supplements for enzymes and stuff to like kill the bad stuff in the gut and then rewire it um, with good supplements to get it like healthier or whatever.
They can, first of all, different functional medicine doctors can vary. Like they don't all work exactly the same. They all have their own style of doing things, but I think the basics of it is like they do a lot of testing. Like
Yeah.
testing that you would never get at a conventional doctor. They
No.
test all your levels of everything, all your hormones, all your like vitamin mineral levels, like they do a whole body approach. They don't view it as like when you go to the conventional doctor, you have to go to a doctor for your ear, nose, and throat. You have to go to the foot doctor, the heart doctor. They're just going to look at your body as a whole of how it's functioning all together. And then they do typically prescribe a lot of supplements.
Yeah, a lot. I mean, I think
I guess
like,
it depends
way
on which doctor
overkill.
you go to.
Yeah, I think it does. I know
Yeah.
the first one she prescribed a lot. The second one I went to prescribed like an insane, like it would have probably been like $500 a month to keep up with the supplements that she prescribed.
That's what's kind of turning me off from functional medicine. I personally don't feel like supplements, especially an insane amount of supplements, is the answer.
Mm-hmm.
I just don't think I feel like our bodies have the innate ability to heal themselves, and that we need to figure out how to give our bodies the conditions it needs to heal itself. And I know that they're going to say that you need all these supplements to do that, but I don't know. I don't necessarily agree with that. Maybe
Yeah.
unless you're in a really bad state of health, maybe. But
Yeah, like to kind of like jumpstart your body back
Yeah.
into normalcy. And I know like whenever they do the testing, they don't just look at like a conventional normal range. Like their normal range is a little bit probably different because they're trying to look for like optimal range,
Right.
not just normal, but optimal.
Yeah.
So they kind of look into that to find little small issues that might, make a bigger issue. And then, so these doctors usually like you'll have a longer like intake appointment where they'll, learn about you and maybe decide what labs they want to order. And then afterwards they'll probably do like a half hour like follow-up appointments. And usually they're pretty pricey. Insurance does not cover these. I haven't found any functional doctors that insurance covers. But it's like $150, $200 per appointment to even like go to a functional doctor. So it's not for the faint of heart.
Yeah,
I kind of
pretty
just
much insurance
ahead.
doesn't cover pretty much any alternative
Any.
therapy.
no. But I think functional medicine is probably like your most expensive one,
Yeah, I feel like, I mean, if you're really dealing with some serious health problems, overall, I feel like it is pretty affordable if you compare it to conventional medicine.
Oh yeah, I
You know
mean
what
if you
and you also
like
don't require a million appointments. Like you can go for your initial, like there's some doctors I know that you can go for your initial appointment, then your testing appointment, and then like they're going to tell you what you need to do, and then if you want to keep seeing them afterwards, then that's up to you.
So then you will have like little follow-up appointments. Maybe you're like, hey, I feel like this. You kind of go over different things, or this supplement's not agreeing with me. So you'll have like a smaller appointment. But yeah, like doctors, I mean, I have a horrible insurance policy and we have like a high deductible one. And basically it's almost like having no freaking insurance. It's basically just
I feel
insurance. Like in case something horrible happens, then we'll be covered. But until we spend like $13,000, we're basically paying out of pocket.
I feel like all insurance is real shit these days.
It's just so expensive. Like I don't feel like it used to be this expensive, but lately it is. So it's like honestly, a functional doctor is just as expensive as going to a regular like I went to my normal gynecologist and they charged me the same amount as this functional doctor does. So
Yeah.
maybe not. So anyway, they will run the test. A lot of it's just simple blood work, like LabCorp, Quest kind of place you can go and get the blood work done. And then the specialty test, like a stool, like GI map, is something that they like ship to your house, and you are kind of in charge of it. You collect the sample. And you send it off, and then you'll get these lab results from it. So the GI mapping tests for pathogens, bacterias, parasites, fungus, yeast, viruses, for toxicity, absorption issues, permeability, and inflammation. So it can kind of tell you a lot about what's going on in your body based off of that. So, we've heard of like leaky gut, and where your gut is just constantly kind of leaking into your body. Do you know a lot about leaky gut?
Yeah, I mean, I've looked into it pretty extensively. I believe, and a lot of people will say, like, of course we can't know because most people don't know that they have. I think most of America has leaky gut. I mean,
Oh, well, with how we eat, there's no way we don't.
Especially with all the pesticides, that's a number one, like, I don't know about number one, but it's a big contributor to leaky gut, as well as gluten and many other things. I mean, stuff we have all been eating. So we all have leaky gut. I would say that. It's not, I can't prove it, but yeah, that's where like your gut lining becomes, it's not supposed to be permeable, or it's supposed to be like semi-permeable. Not I don't know. Like, you're not supposed to have undigested particles of food leaking straight into your body.
Yep,
right?
That's right.
Like, and it's becoming to be like just loose, like holes in it, and thinner and more permeable, and we're having the undigested food particles, and then toxic food that we're eating just free floating around, leaking straight out of our gut, and is causing severe inflammation.
Yeah, it causes like chronic inflammation over time. And then also like, our stomachs and all, we like make enzymes that help us break down food and different things like that. And whenever our body whenever it notices that there's enzymes in the outside of our body, not the outside of our body, in the outside of our gut, in the outside of our intestines, it's like, whoa, hold off, stop making that enzyme because it's not supposed to be out here. And then your body is like lacking the proper enzymes to digest your food. And so it's like this, it's like, it's snowballing. It's like, you're having this inflammation, and then also you're not digesting as good. So like everything starts like, going off the rails at this point. So these tests can kind of help identify that. And then, you can work with your functional doctor to, they might prescribe something to kill off all the bad bacteria and stuff in your gut. And then you'll start taking like enzymes and stuff like that. I mean, at least this is what I did.
Yeah,
and then I started taking
on whatever you're going through.
Yeah, but then I started taking enzymes to like help absorb the good stuff, and then some probiotics and stuff like that.
Yeah, they're gonna typically, probably assist you with detoxing, or diet changes,
yes,
environmental changes, natural approaches typically, and supplements. They're not gonna be prescribing. I would say it was not common anyway, like typical pharmaceutical medication.
No, never done that. It was all supplements, enzymes, and different things. And then diet changes for sure. Yeah, because I mean, like, if you're not going to do any good to like do all this stuff, spend all this money on this, and then keep eating the same stuff that's going to keep making you have leaky gut. You have to make the changes to see the results. It's not going to help.
That's what's great about it, because your conventional doctor is never going to tell you to make these changes in your diet or lifestyle. They just they might mention, oh, you need more diet, you need to look at change your diet and exercise, and that's it. And typically the diet, any nutritional information they give you is like outdated and just wrong.
Well, also too, I had talked to a friend of mine, and we talked about nutrition and stuff like that, and what he said is, what's the point of like telling people about nutrition, because nobody wants to listen to that. And it is true. You have to be willing to receive the information. So I feel like doctors have really just given up, because they don't like people don't listen, you know? Like,
I
oh,
don't.
if I give them
I
a pill, maybe they'll take it. But if I tell them to do X, Y, and Z and stop eating gluten and dairy and all this stuff, they're going to be like, yeah, no, I'll just
I
not doing all that.
disagree. So I was listening to a book by Casey Means, and she's been a doctor for years, and now she's, transforming the way she looks at things. I think she's become a functional medicine doctor. And she said basically in medical school, they're taught that people don't care, that people don't want to change their lifestyles and diets, and that's really not true overall. They're taught that patients are lazy and don't want to, do the hard changes. But like you can't just make that assumption and then just give up. A lot of people do want to be healthy, but when you have doctors giving up and not saying, like, making that priority, they no longer believe that it's a priority.
Yeah.
You need your doctor to push the issue and make, say, this pill isn't going to help you if you don't make these diet changes.
Yeah.
Or this lifestyle change. If your doctor's not pushing that issue, then now we have a whole society of people who believe that it's not a big issue.
That's true.
That they can rely on just pharmaceutical medication and just to write people off so quickly as, oh, they don't care, they're lazy. I don't think that's true for the most of people. They've become that way.
Yeah. Yeah,
Because
we need our doctors to not just like be compliant. Doctors that push the issue and say, no, like this is not cool. I guess I don't know. It's such like a difficult thing to like not turn people off, but still be committed to helping people in that way.
I mean, how could you just give people pills that aren't really going to change their lives, knowing that, just say, give this and be like, okay, you're good to go now. But like a lot of them don't know. A lot of them really believe that these pills are all they need, that they don't really need to, they really do.
I know. It's crazy.
Because they're just, not because they're bad people, that's what they were taught.
Mm-hmm. Yep. It's complicated.
So a lot of these tests are like ridiculously expensive, and a lot of us just can't afford that. I can't afford it. That's why I don't go. I don't go to the functional medicine doctor, and I don't get these tests. But that's why I've really taken my health into my own hands. I read books. I listen to books. I've really taken the time to educate myself. I know a lot of people don't have a lot of time, but audiobooks are really great, and you can listen to them on your free time or when you're doing things. So I really encourage people to believe in yourself, that you can learn how to take your health back. I know some people might be dealing with serious health concerns, maybe like cancer or maybe Crohn's disease or whatnot, and you do need to look to these people. So you're just gonna have to figure out how to budget or make sacrifices in other areas to maybe afford and pick and choose what tests you feel are necessary, and just but definitely try to take your health, and don't just rely just on doctors. You can do so much on your own. And honestly, the basics of health usually start in the gut and from our environment and what we're putting in our body. So if you just start there and learn what's appropriate, you can really make significant changes.
Yeah, for sure. Yeah, and you can go on like Reddit or anywhere and like find gut protocol and just you can just do it and make changes in your diet and stuff and just like assume that you have leaky gut and like go,
right, like that's what I do.
Yeah, just assume you have it. The stuff that I'm not doing any crazy like hardcore detoxes or anything. It's all pretty like normal stuff.
Yeah.
So I don't think that, I wouldn't think that anybody would have any major issues. Of course, if you have medical issues, then you should always consult with a doctor first.
Yeah, always. Everything we're saying, always consult with a doctor first.
Yeah.
But yeah, like all the interventions for these things, when you're taking a natural approach, are generally safe. You're just going to be living more healthier, know? So I just assume, like right now, I believe I have leaky gut. I believe I have
SIBO.
SIBO, yeah. And so I've just been trying to work on that as if I had it.
Yeah.
Yep.
So another test is called the Dutch test. It's a hormone panel. It's not like, so the thing with taking blood tests at the doctor or wherever for hormones is that hormones are fluctuating all the time. Like every hour, whatever, you could have different results, or maybe not hour, but different points of your cycle will be different. Progesterone will be high or low or whatever.
Oh, they are by the hour.
Oh, by that, yeah.
Yeah, hormones are changing all the time by the hour, yeah.
Yeah.
I
So the
would.
Dutch test is a series of urine tests where you have to like kind of pee on a test strip, and you take them like different points of the day, like right when you wake up. If you go to pee in the middle of the night, you take one. You take it like so many hours after you wake up, and at night, and different, like you have all these different pee strips that you have to track. And then you send it in, and these also are pricey, like $500 to $650 for Dutch tests. But what it tells you, it's kind of crazy to look at the results on these, is kind of how your hormones are metabolizing in your body. So not just that, like, oh, your progesterone's high, but it kind of gives some insight into like maybe more of the why and what's going on. Like it tells you how your cortisol fluctuates during the day, and like it tells you the normal cortisol, the normal cortisol graph and yours, and a bunch of different things. It tells you what kind of estrogen you're making, because there's like estrogens, which are like more of the bad estrogens that you don't want. So it kind of gives you a lot of insight. If you're having hormonal issues, it's
Yeah,
probably
that's really
wise to
helpful.
get that, because
Yeah.
it's not just like a piece in time. Well, who knows why it was like this? It kind of gives you more information,
Yeah.
um, that you can, I mean, even if you get the test and like you want to like look at the results and like figure it out on your own and like do research and all, I mean, you can do that. It's just like
Yeah.
kind of easier to have someone just tell you what it is, what it means.
Yeah, but if if money is an issue, you can just get these tests on your own. There's places that you can order these tests, and a lot of them will interpret it for you, to a certain degree.
Hmm.
The doctor comes in and tells you like what you need to do about it,
Yeah.
but you can get the test, read, have the results will be interpreted for you, and then you can try to do your research on what kind of changes you can make to fix it.
Yep. All right. So I saw like a lot of functional doctors, well, not a lot, a couple of functional doctors in the past couple years, but I went this year to a really popular one, and she put me on a lot of supplements, and I just got to the point where I was like, I can't, like my throat like literally doesn't even want to swallow pills anymore.
Oh, I
Every time I
bet I
swallow a pill,
couldn't.
it gets like lodged in my throat. Like I just can't be doing this. And also it was costing a fortune. And I
Yeah.
really, I started this back in like January, and by like June, I wasn't like having any sort of like great feelings, or I didn't feel any different or whatever. I don't know. So I stopped taking most of the supplements. I kept some of them that I believe I researched each one and decided which ones I was going to keep, and was kind of feeling turned off. But then I decided to look into someone else, and I decided to start seeing a nutritionist instead. And nutritionist, this lady that I found in New Orleans, is kind of like a mix between like a functional doctor and like a almost like a dietitian, sort of, maybe. But she looks at the same tests. She also does supplements, but I think she does like a lot of herbal stuff and a lot of diet changes. What can I eat that will help me make my own estrogen? What can I eat that's going to help me with magnesium and stuff like that?
Yeah, because food is medicine, and I
Yes.
really like that approach. I think that you're going in the right direction with that one. I think if I had to go, I'd do something like that.
Yeah, and she was like, there are some things that like it's just easier to do as a supplement, because you're never going to be able to
Yeah.
eat enough of enough of that to really make a difference. So like we're going to supplement with magnesium, like, and most people are going to be taking magnesium because it's hard to get as much as we really need. So I'm really excited. Her name's Jennifer Vitry. I just started seeing her. We did like a consultation, and she took all my old labs from the beginning of the year. And she's working on a protocol for me to help me with my issues. And then I'm probably gonna have to do some repeat testing at the beginning of the year. Probably a new Dutch and maybe not a GI map. Who knows? Um, so I'm excited. I really liked her, but I'm excited to try and mess with my diet to help get these things. Um, so another thing that a lot of people do is heavy metals detoxes. So like the functional doctors can test and tell you if you have heavy metals present. And these are kind of iffy. Like I don't know a whole lot about heavy metals detoxes. I know there's different things you can do. You can like chelate to get the heavy metals out of your tissues and into the bloodstream, but that can be like really tricky if you
Yeah,
don't
and
bind
dangerous.
them to get them out. Yeah.
So, like, from what I've kind of learned through the research I've done is that you have to be careful with heavy metal detoxes because, like you said, like you're basically pulling those heavy metals that have been embedded in your body somewhere, kind of like in, I would not inactive because they're causing harm, but they're not just floating around in your bloodstream. You're pulling them out of there and having them float around. Now they're like just going around your body, so that hopefully you can eliminate them through our sweat, our pee, our poop. But it causes you, you're going to start to feel bad, especially if you do it too much, and it could be dangerous. You could
Mm-hmm.
cause issues. So I think that's definitely something you'd want to do under the care of a doctor,
Absolutely.
unless you're doing it like naturally, like you said, some people do use cilantro or like just natural things. Like honestly, I think any kind of heavy metal detox should be natural and slow. Or like I use garlic, honey fermented garlic for detoxing. That's all natural. That's not, but they do have things like I did buy this spray. It's Caseva, THS, I think spray. I'm not real sure about it. I started it and I started to feel terrible.
Yeah.
So I stopped because that kind of scared me. I don't know. You have to kind of
Yeah.
feel those situations
I
out
feel
what
like
you're
you have to do a
comfortable with.
lot of research before you start
Yeah.
messing around with that, because you don't want to just have lead recirculating in your body, especially depending on, like if you're going to get pregnant soon and things like that. It's definitely
Yeah.
things to consider before you start doing that. But I know like amongst this group of people that are interested in functional medicine and stuff, that's like a big thing people talk about is heavy metal detoxes. Um, yeah, like I would just be very careful on how you do that, because you could, if you don't properly bind the metals to get them out of your body, you just basically just screwed up your whole system.
Yeah. Definitely. That's definitely something you'd want to do with a doctor, I would say.
Yeah, so
And
I
if
know.
not, just do cilantro or garlic or something like that, and and that'll just be a slow process. That might take years, but it's something you can do that'll help.
Yeah, and I know I was researching and they said like dietary fiber, so foods that are rich in fiber, people that eat a lot of fiber-rich food reduce their mercury levels in their brain and blood. Chlorella increases detoxification of mercury in mice. Sulfur-rich foods such as garlic and broccoli may be good chelators. It's research suggested that garlic may have prevented kidney damage from cadmium, and reduced oxidative damage from lead in rats. Cilantro, like we said, there's not a lot of evidence about cilantro. In an animal study, they found that it decreased the absorption of lead into the bone. Um, so there's just different things, but I would definitely say you got to do a lot of homework before you start messing around with that. We do not know a lot about it. I've never personally tried to do any heavy metals detoxes. So I would be hesitant and informed.
Yeah.
So, we kind of talked about biological doctors, functional medicine, nutrition, and stuff like that. So then there's some other things like body-based things that you can do. And one of them, like I mentioned earlier, is acupuncture. So I did acupuncture when I was trying to get pregnant. They say that acupuncture points where it's just, they put the little needle in, they hit a certain point that's believed to stimulate the central nervous system, which releases chemicals into muscles, spinal cord, and the brain. And these biochemical changes stimulate the body's natural healing abilities. So they say the chi flows through meridians or pathways in the human body. These meridians and energy flows are accessible through 361 acupuncture points in the body. So you can get balance that way. Have you ever done acupuncture?
No, I haven't, but I'm very intrigued by it. I highly, believe that we are energy, that everything is just energy, and like that's the core of all existence is energy. And if you can focus on that, I believe we can definitely heal ourselves in that manner. And if that's what acupuncture is doing and how it's approaching health, I think that is a great avenue to seek. you know. Definitely something to look into.
Yeah, it's interesting. I mean, like, I did it for a while. I didn't feel like insanely different. I didn't have any different like fertility outcomes or anything. Not that I don't know that I would. But I've had other people that do it and say that it helped them get pregnant and different things like that. So I guess it
It's
just
all
depends.
because, yeah, I mean, we all have our different needs, but I also want to mention that your belief system in it, you know, you have to believe in what you're doing. If you're not believing, or you're very skeptical, or, you know, that's definitely going to skew the results of what you're doing, you know.
Mm-hmm.
Like, the mind is a very powerful thing, and it's very important that we have faith in the treatment we're looking into or seeking out, and try to believe that you can find health,
Mm-hmm.
you know, believe in the process.
Yep.
But yeah, we all have our different needs, and, you know, acupuncture may work for one person and not the other, and that's just part of the journey of figuring out what works for you, you know.
Mm-hmm.
Just like diet, you know, one diet could work for someone else and not for you.
Yep. That's right. So the next one is chiropractor. So I love my chiropractor. I have some bulging discs in my neck, which are all like normal kind of age related, degeneration or whatever. But I go to him and he does whatever he does and I feel better. So I will say that I really like that. They manipulate the joints in your body, and it can like reduce pain. It can correct your body's alignment and how your body functions physically. So I really have had several different things treated in the past by a chiropractor, and I love it. And it always makes me feel good when I go.
From what I understand, I guess a lot of people think of chiropractors as just like, working with the bones and aligning your bones or whatnot, but it's more than just that, you can go if you have a sinus infection and they can like release the pressure in your sinus cavities, or just them realigning your body can help the energy flow correctly, or your blood flow better and correctly. It's a lot deeper than just manipulating the bones, and that's something I didn't know. I have a friend who goes to the chiropractor when her kids are sick and for other things, and it's not just for bone issues. I've been wanting to go, and I feel like the way she was explaining it, I guess they're all different, but it seems very affordable. This one she was talking about was like $150 for your first visit, but everything after that was like $50 a visit, which I know would consider affordable.
I pay $60 a visit. That's with my insurance, but I want to say that's also like their self-pay price. So it's not horrible.
Yeah, that's another thing. A lot of especially with, like, I'm talking about it in regards to conventional medicine. A lot of times you go to these doctors, and with insurance, you end up paying more than if you would have just said, don't use my insurance, because they give you a discount when you don't have insurance. Yeah. And sometimes you'll pay less not using insurance than you would with insurance. So that's pretty crazy and something to look into.
Yeah, unless you're like trying to, like, if you think you're going to meet your deductible or whatever, and you like want to put it towards your insurance so that you will. But if you like me are not even close to hitting your deductible, then it may even be better just to not even bother with it. Yeah, because they don't even feel like dealing with insurance either. That takes time and energy from their admin to like deal with all that stuff. So yeah, I mean, I went last week. I had this horrible, horrible headache. In fact, I had talked to you right before I went in, and I was just like absolutely miserable. And so I went to him to see if there was anything he could do, and he did some manipulations. He said like that I was like my lymph wasn't like draining, like because of some blockage there. So he did stuff, and I like left there feeling so much better. And I had a headache for like 2 days straight, and it's finally stopped after that. So I am all for it.
So you did have a good, like, I remember I had spoke to you right after you left, and you were feeling better, and you were like, we'll see if it lasts. So it did.
So like he did that. He adjusted my neck, and it helped that flow. And then he did some crazy like Like I mean, he pressed so hard, like here and here, like on my cheek and my forehead. I felt like he was gonna like break my bones and my face. I was like, oh, I don't know. But
Wow.
and then he really massaged on my neck to like get it to like drain, and like my headache went away almost instantly. It did kind
Wow.
of creep back up like for a couple hours, but then that night I went to sleep and then didn't have it again.
That is
Um,
so cool. I love
yeah.
that.
So I really liked it. So another one kind of going on that is massage. So there's different types of massage out there and they kind of do different things. Like rubbing, your body. It obviously reduces your heart rate. You have lower blood pressure, increases blood circulation and lymph flow. Makes you feel good. I mean, if you're into massages, I don't know who's not into
Yeah,
massages.
like
It's
who
like the
is
best thing on earth.
it?
Like
Yeah.
my like literal favorite thing ever. But it moves the fascia under your skin around. So I love a good massage. There's different types like sports massages and like super deep tissue and Swedish, which is just like nice friendly touch.
And it could,
um,
oh, I'm sorry.
no, go.
Well, it could help release tension, which
Hmm.
you would be surprised how much pain tension can cause you. That's something I struggle with. Now, I can't speak on massage. Look, I'm not one to go to the doctor or any kind of therapy just because of money reasons. I just can't. Like, I probably could, but I'm always like a DIY or trying to just do things on my own. I'll get Nick to rub me down, you know? But, like, I can get to where I am so tense that I clench my teeth so hard that my teeth are shifting, and I do that. I can't even stay consciously aware of it enough to stop it. It's so crazy. And then like I'll get so tense to where my neck is so tense that it causes headaches so bad, and like I just hurt and ache, and like I have to focus on like sometimes meditation. I'll have to like really focus on meditating. That worked really well for me once. And then I tried to do that heavy metal detox with the cassava stuff, and it came back. But yeah, so tension, like sometimes I'll get Nick to give me a massage and it'll help a lot. So you'd be surprised how much a massage can help with that and how much tension causes a lot of issues that you wouldn't think.
Yeah, and there's so many other things. Like I go see this lady, Miss Donna. She does like abdominal massage or whatever. Um, it's kind of like so she from what she describes as she like releases blood flow and like stagnation and stuff like that, and like she's feeling and she's like, oh, here's your stomach, here's your liver, like as if she like feels those organs in my belly, and she's rubbing them and she'll be like, this is blacked up. I know, like I have this one spot on my side and it's always like very ticklish, and like so she'll start and that side is just so like uncomfortably ticklish when she rubs it, but she'll keep going and keep rubbing it and keep rubbing it. And one time, literally, like, so I'm laying there and she's doing it, and it's like, it's hard because like it tickles so bad. I like have to deep breathe and stuff to like just get through it because it's so uncomfortable. But one time she was doing it, and all of a sudden I just had this like rush in my head, like this wave of like instant like flushing and almost euphoria. And she was like, I didn't say anything, but she was like, oh, I finally released it. And I was like,
Wow.
dude, is that what that was? And then like after that she can touch it, it's not sensitive at all anymore, whereas
Where
before
was
I was
this?
basically like grabbing the side of the table.
Where was this on your body? Like by your liver?
Like right above my left pelvic bone.
Right above your left pelvic bone. Interesting. So that
Like to the
was,
left of my belly button.
did she say what? That seems like where your
It's
colon
my, I
would be, or
think it's
your
my
small
lower
intestines.
intestine or something.
Yeah.
I think it's where my colon goes into the lower intestines or something. Something like that. And it's every time I go, it's the same thing. Now, I don't always feel that like rush like I did that one day, but every time I go to her, like I just feel amazing after. Like just so calm. I feel like I have a new lease on life every time I see her. And I feel like it's just because she's opening that blood flow, and then I finally get good blood flow. But, you know, she also says you're supposed to do self massage at home and stuff like that. And I'm really bad about doing that.
Does she show you how?
She does.
Does she rub hard?
No, it's a light touch.
This is very interesting. I need to go to her, and I want to learn what she learned. That's interesting.
Well, she's actually having a bunch of classes on.
Really?
Yes, like for every month from now to the end of the year, she's doing a class like one Saturday a month, where she kind of teaches you how to work on your own body, and I'm planning to go.
Isn't this the one that you said she learned like in another country? This technique. And
yes.
What's the technique called?
I think Mayan, like abdominal massage or something.
Interesting.
Dude, it's crazy. Like, I think she's a healer. I don't know what she does. Sometimes I look at her while she's doing it. I'm like, what is she doing? Like, what is she thinking? Like, how does she know this? You know, it's just crazy. Yeah. But I swear on it. It feels amazing.
That's such a good point. Like, you know, we kind of categorize health like we're doing right now, like functional medicine, chiropractic, but there's so many other just random things that people do and have learned. Sometimes it's ancient things, or sometimes somebody might just have a special gift. I don't know, but there's so many things we can look into instead of thinking in a box. You know, we have to think outside of the box. And, you know, as long as nobody's like pushing chemical drugs down your throat and this is all natural, I don't see the harm in trying, you know?
No, I love her. I don't know. You know, she's kind of older, and I don't know how much longer she's going to be doing it for. I feel like every time I ask her, I'm like, so you going to still do this? Like, what's the plan? Because, like, once she doesn't do anymore, I'm like, who am I going to go to for this? Because it's, like, a definite part of I do it probably, like, once a quarter, but I love it. So
hopefully she can train somebody up to take over. Maybe it could be me. I would like that.
So the next thing that's kind of like that with energies and stuff like that is Reiki. Some people go to Reiki. I know I did that too whenever I was trying to get pregnant. One of my friends, Amanda Fresh, she does Reiki. She teaches it. She does all kind of cool stuff. But that's kind of like where they lightly place their hands on you or like hovering just above you. And they're basically acting as like a conduit for universal life force energy that exists around us. So it's like, there's this theory that like stuck energy leads to pain and illness. So they're basically trying to do like an energy cleanse on you and like move that stuck energy. So it's interesting. I mean, it's very calming. It's like a meditation kind of state that you go through. I like it. It's expensive.
You know, going into something, I'm sorry, but going into something like that, tried it. Like if you were, first of all, don't knock things. I know a lot of people are going to be like, oh, that's so woo-woo, you know, but don't knock things like that until you try it. And maybe before you would try something like that, maybe try to educate yourself on energy and, you know, how we are energy. And that's like, it's just what we are, like all around, we are energy. And so once you start to understand that, doing things like this will make more sense and help you to believe in it more.
Yeah, I mean, it's amazing. So she does, Amanda Fresh, you can go find her. She does a lot of different things like around this energy and meditation and things like that. Like every other Thursday, it's actually tonight, I think at 6:00, she'll do a meditation that you can do. You can do it in her office in Covington, or you can do it on Zoom. But she kind of helps guide you to open up to the spirit world and things like that, and communicate with your like angels or your spirit guides or whatever you want to call them. And it's like kind of amazing. Like I've done it a few times, and I have felt I felt that I was receiving messages and things like that. So I think it's really interesting. And it's like if you can just like get your mind around it and do the work that it takes to be more intuitive and things like that, like I really do believe that you can like get these messages and, you know, help your energy and all this cool stuff.
Yeah, and you know, focusing on your energy and things like that will also help you to be more in tune with your body and your conscious, you know, like to help you to understand your body and your soul better on another
Mm-hmm.
level instinctually, you know, and help you to listen
Yes,
and
because the
understand
thing
how
is,
to.
like, we are so accustomed to tuning those things out, and we don't
Yes.
listen anymore, and we don't listen to our intuition, our gut, and all those things. But if you can try to work on listening to that and listening to your body and doing a meditation and asking your body what it needs from you, you might be surprised at what it tells you, you know?
Exactly.
You like might get a message, just like this random thought, like whatever, I don't know. It's just really cool. It's really cool stuff. I dabble in it. I would love to get better, but I'm like a scatterbrained ADHD kind of mom over here. But I know it's like on my list of
Yeah,
things
of
that
all
I
the
want to
things,
be.
huh?
All the
Yeah.
things. Yeah.
How much do those Zoom meetings cost?
Her Zoom meetings are $20 or $25.
Oh, that's not bad.
Yeah, I think
And
I'm
she
gonna
does
try to
them
do it
how
tonight.
often?
Every other Thursday.
Okay.
So today is September 5th, so she'll have one today and then skip a week and then the next one. Um, but
That's
yeah,
not bad.
I think it's cool. I've had some really good experiences in her classes.
Very
So the
good.
next one is kind of an interesting one, and this is kind of like our background is Traiteurs. It's a
Yeah.
Creole or Cajun healer. These are traditional healers of the French-speaking Homa tribe, whose primary method of treatment involves using like the laying of hands, um, and like Catholic prayer, medicinal remedies. They were thought to treat all sorts of ailments, including like earaches, toothaches, warts, tumors, angina, bleeding. In the past, like back in probably like our grandparents' era and going backwards, they were used in lieu of traditional doctors because most people didn't have access to doctors or couldn't afford them back then.
Yeah.
And they were in the remote areas of the Acadiana area. So these are pretty interesting because Rachel and I think that's kind of how we really got started on even talking about this, is because
Yeah.
we started talking about that. Because I remember growing up and like my grandma had a traitor, and so I remember, different things that she would tell us to do based on what that person had said. And, unfortunately, our grandma passed away many years ago, and we didn't really we weren't into this back then. We would talk to her, but not about this kind of subject. So I reached out to our cousin Joyce, who lived with her, and they were like probably, I would say, the closest out of anybody. Um, but well, I mean, I wouldn't say that, but they were
Yeah.
really
They live
close.
together. She
They
lives
lived
with her.
together, so I'm sure Momo talked to her. Momo must have talked to her more than anybody.
Yeah.
And so she knew of the traitors, and I had a conversation with Joyce about it, and it was really interesting. So like these people have gifts from God, and they do this healing. They might talk in tongues or in Cajun French, or sometimes in Latin. Um, there's different people that can do different things. I know
Yeah,
she
like
said.
I'm sorry. They believe that like each one has their own gift that they were given from God, like one
Hmm.
special gift. So each one has their own special gift from God, and that I think that they can't tell people what that gift is. I think I could be wrong about that
Hmm. Yeah, and like you can't thank them. You cannot give them
or pay
money or
them.
gifts or anything like that. You just like go for what you do, and like you like, all right, peace. Like
Yeah, or
apparently, I
it
don't know,
won't
it's like some
work.
kind of superstition or something that like if you thank them or you give them something, that it will not work. The treatment won't
Yeah.
work. Um, but yeah, apparently my grandma brought my dad there whenever he was a kid and like treated warts on his hands. And I know Joyce said she brought one of her nephews to one that she knew of and treated. I don't remember what it was. He had something wrong.
Fever,
Um,
wasn't it fever?
oh, he had these horrible fevers, and like
Yeah.
nobody knew what was happening. But I guess they went there, and he doesn't have the fever. He never got the fevers anymore after that or whatever. So,
I went when I was a
um,
kid too. She brought me. My mom brought me, and because every time I would eat, I would get a stomach ache. And now looking back, I know why. But but she brought me because she thought I had worms, which I might have. Who knows? But I remember going and like I sat in a chair, and the man, he prayed over me and kind of did things with his hands. And I can't remember if he gave me any kind of like medicinal herbs or anything. But and honestly, I can't remember if I still had stomach aches after that. I mean, eventually I remember not really complaining about it as much anymore. But yeah, I remember that experience, and I remember her always saying that we need to go to the healer. We need to go to the healer. You know, she really believed in that stuff, and I wish so bad that she was here, because I have so many questions I would like to talk to her, ask her about, and talk to her about.
You can do a meditation tonight and communicate with her as your spirit guide.
True. I have tried.
Seances and whatnot.
No. No.
You know what's funny is after I was talking to Joyce about the Traiteurs and all this stuff and thinking about herbal medicine, is I started to question, at what point are we considered witches?
I know. I've considered that many times, especially being into herbalism.
Yeah.
I was like, this is what people used to call witches, you know? Like, so it's like kind of crazy. I feel like the whole witch thing, even the traiteur thing, I mean, some of the stories we were talking about with Momo and how she used them could kind of sound witchy. But I think it's all in the way we view things. I think people are very quick to say, "Oh, that's a witch. That's witchcraft."
Yeah.
And I know that a lot of things that I do are not evil, and things that I might believe, and things that people like, they're with good intentions and even done with prayer. So I mean, I think people have just gotten in a box, and a lot of religions have just tried to demonize some of these things because people fear what they don't know or understand.
Yeah, that's true. And, you know, a lot of this stuff is hard to comprehend and understand. We're talking about energies and all that stuff. I mean, that's kind of, like, you can't see that. There's no, like, proof, you know, like, it's hard to prove that. Yeah. But it's funny. We should call ourselves the holistic witches.
Yeah.
So another cool thing that I've heard about is called biofeedback. Now, I don't know a lot about it, but I know it's like some chiropractors do this. And it's kind of like this mind-body technique where you like are connected to electrical pads, and it helps them like get information from your body. And like they can use this, like you can like watch images, like when you're trying to, like, let's say if you have like a horrible fear of something, then they can kind of like work with imagery and stimulation to like overcome that and other different various like things like anxiety and depression and things like that. So that's kind of like a cool thing. I've heard some people say that they've done it for like food allergies and gotten like seen a lot of progress with not being allergic to foods. I have no idea how it works. Like,
so
I saw.
This sounds. Oh, I'm sorry.
Go ahead.
No, you go ahead.
No.
Well, I'm so sorry. I keep cutting you off.
No, it's like I'm go for it.
Okay.
I don't know what I'm even talking about.
So this sounds a lot like something I recently heard about through my friend Danae. They have a quantum energy wellness bed, which uses frequencies and I believe mainly frequencies, and maybe there's more to it. You lay on this bed for so long, and it helps to, I guess, heal you with frequencies. Also, she spoke about doing, I believe it's called muscle testing, which sounds a lot like this, where I'm not exactly sure. She kind of explained it to me, but it's fading from my brain. But it's something like, I remember her saying something like, you get their finger, it's like, you ask them questions and then you watch their feedback, or you watch how their muscles react or something like that. And it sounds woo-woo, but it really, as she broke it down, it makes sense to me that could be a logical way of finding, your issues or problems you may be having with certain things.
It's kind of like an alternative to, like, let's say your GI testing, your like actual like results. It's like a different
Yeah.
way to kind of get to the same, like whether you need treatment for it. Like they can kind of test to see like, oh, or is milk making me sick, and somehow they do this biofeedback and determine whether or not your body like agrees with it or not.
It's kind of it's kind of going back to believing that your body knows what's best, and that you can, learning how to listen to your body, that our body
Mm-hmm.
does know how to heal, and that, you have to believe that, and trust in that.
Yeah, I think these biofeedback sessions are pretty expensive too. I know at that lady, Miss Donna, that healer, she had like a pamphlet for it, and I had called, and it was just like all this stuff. It's alternative, and it can be pricey. So I was thinking about doing it, and I might one day, but not for now. But there's all kind of different stuff that you can use, like things in your toolbox that you can have that you can try to see what works for you. Another one, we kind of talked about it before, was meditation. Meditation is
Oh
very
yeah.
powerful. I believe that everyone should meditate every day. Now, do I listen to that? No. I did it this morning.
I know. I wish
Pat
I
on the
did it
back.
so much more than I do.
I mean, it's great. Like you can do different types of meditations, like progressive muscle tightening and stuff like that can help you, like decrease anxiety and stuff like that. I will do sometimes like manifestations where I go on YouTube and I type in like whatever I'm looking for and however long I want to spend doing it. And sometimes I'll do like parenting manifestations where just like I repeat in my head things like, you are an excellent mother, like you will like glide through the day with ease, like all these different things. And it's just like you're just like repeating that in your head. You're telling it that you're going to do this. And like I find that whenever I do those, I I am a better mom during the day, and it helps me also to just hear that. And sometimes like in the mornings I'll do them, and like there's certain things that they'll go over in the meditation, like imagine you're on the boat and the waves are crashing and you hear the rustling of the leaves and things like that. And whenever you feel like you're about to lose your calm today, just imagine being there. And so if you can like work on this, then I'll be feeling like, oh God, I'm about to explode. And sometimes I can close my eyes and I can bring myself back to that meditation and being in the boat and the waves hitting the boat and the trees rustling, and like take a deep breath, and then like you can calm yourself down. You're calming your central nervous system down.
Yeah.
By like going back to those visual cues and imagining how you felt during that meditation in that moment of high stress. It takes a long time to be able to train your body to do that, but
It's like working out a muscle.
Yes, it is.
So that's why it's important to keep doing it and keep trying. A lot of people say I can't meditate because I can't shut my brain off. I can't shut my brain off. I'm one of those people. But that's even more of a reason to keep trying and keep doing it, because it's like working out a muscle. But you don't have to. Your brain is always going to have thoughts, and you may never get to a point to where you're just going to have no thoughts.
Yeah.
That doesn't mean you shouldn't meditate. So like Heather said, you can do guided meditations like on YouTube and stuff where you do it specifically maybe about parenting or whatever, but you don't even have to do that, which not that I'd say you shouldn't. You definitely should. I think that's great because our bodies are listening. When we say, oh, I'm so fat, or oh, I'm such a bad mom, see, I felt bad even saying that. Like my body's listening, and it's important that we don't say things like that because we're manifesting that into reality, so and negative self-talk is such a prominent thing in today's society. We talk so negatively to ourselves out loud and in our minds. So doing those meditations where you talk positively to yourself is really important and great. And when I do those, I do have a better day for sure.
Yes.
And honestly, it's something I need to do more often because I'm really bad about negative self-talk. But sometimes I just sit there, especially in the morning when I go out for the sunrise, and I just listen to the sounds, and I just try to clear my mind. And when a thought comes into my head, I acknowledge it, and then I just kind of, try to push it away and go back to the side, back to listening to the sounds. I try to focus on the birds or the wind or whatever is going on. And I think that's like kind of there might be even a name for that. It's like training your brain to be in control of your thoughts, acknowledge that they're there, but controlling it,
Mm-hmm.
and understand that you can control it. And
see, I struggle with that kind of meditation. Because my brain has too much free will. I think it's like easier for me to do a guided one. That way I can focus on what they're saying more and visualize it.
Yeah.
But I know it's hard.
Yeah. And I mean, you got to find whatever whatever brings you peace and whatever feels good for you. Sometimes I just sit there and I talk to God, which I guess you could say is praying. But sometimes I just like sit there and talk to God like a therapist. Like and honestly, I get a lot of relief from that. I love doing that. That is how I've built a personal relationship with God. I feel like I've found God through doing that more than any other way, more than church, more than anything. Mm-hmm. And I love that. I feel like it's meditation, and it's a lot of times that's how I put myself to sleep at night.
Do you talk out loud or just in your head?
In my head. Mm-hmm. If I'm praying, like I'm actually intentionally going to pray, sometimes I will talk out loud. But I guess for me personally, I would call that praying when I do that usually.
Yeah.
But it's usually when I'm like really emotional about something that I'll do that.
Yeah.
Yeah.
Yeah, so there's so many different tools. I'm sure there's so many more like out there that we didn't even talk about. I kind of just chose the most prominent ones, especially some of the ones that I've actually tried. But there's just so many things that you can explore when you're having health issues, when you just feel like crap and you're looking for answers. There's so many different avenues that you can explore. And we hope that today it kind of enlightened you maybe to do some more research about one of these avenues, maybe incorporate something into your life that you hadn't really thought of before. I would say if you're going to pick anything from what we talked about today is do some meditation, because meditation doesn't cost any money. It will only make you feel better. Even if you can do it for 5 minutes, 10 minutes, however long you can, go on YouTube and find something that you feel good about. I just do like meditation, 10 minutes, positivity, or what I like to do is present, like how to be present and focus in the moment. So there's just there's any meditation you can think of, you'll find it on YouTube. Or just go outside and listen to the breeze rustling through the trees and the birds chirping and stuff. That will make you feel so much better.
Meditating in nature is really, I think, adds to it a lot, especially if you could have your body or feet on the ground and the earth, even better. But I agree with that 100%. If you're going to try something, do meditation. Like you said, it's free. And I've had so many good results from that, especially when I was doing it consistently. I haven't been lately, but when I was, especially when you sent me that one from YouTube, I was doing that consistently for a while. And that's when I got rid of that tension. And I was just having a really great time. Like, I felt like my energy was great. Like, I felt good. So
yes.
Meditation is very powerful.
Absolutely.
A great way to start listening to your body and get, and be intuitive and learn your body again, too.
Yep, absolutely. All right, guys. Thank you so much for joining us. We really appreciate you. And we hope that you like this episode. Please subscribe, comment on YouTube or Facebook. And we hope to see you again next week. Bye, guys.
Bye, guys.